No.
Okay, cool.
And it's disgusting, and I can't believe I'm revealing it to the internet because it's like it's the thing that embarrasses me the most in the world.
So we're gonna have a revelation no one knows about this.
Hey guys, it's Molly here again for another video, and I have no voice, which is why I'm here with the doctor.
You gotta fix the voice, right? That's what I'm here
Yes,
for.
that's my job. And your job is to fix people because he's a real doctor. It's legit, you guys. This is Dr. Mike, for those who don't know. But I know a lot of you do because Twitter's been blowing up asking me to collaborate with you.
Yeah, I mean, your fans and my fans have been so supportive about us getting together.
Yeah.
I think there's a lot of crossover in what we talk about from like a mental health standpoint,
Yes.
being supportive of creators, and I think people want to see it, and I want to see it too. I'm excited.
And now
that
we're
both
here.
Yeah.
I'm so excited. I'm basically just going to do what everybody does and ask you all my medical questions, mainly because I grew up in Canada and I've lived in the US for like, I think about 18 months now, and all of a sudden I don't have free healthcare.
Oh.
So I used to be one of those people who like went to a walk-in clinic for free on like a random Saturday because like I had a weird bump on my hand, you know, and it would just be free. And now I can't do that. So over 18 months, I've just collected medical issues and just done nothing about them.
Well, you can't blame that on the financial system, on the healthcare system, right?
Yes,
Do you
I
have
can.
insurance?
No.
Why?
It's expensive.
Well, yeah.
And I'm not used to having to pay for that.
Well, in my eyes, I feel like even if you have socialized healthcare like you do in Canada or the UK, you're still paying for it just through taxes, right? It's kind of just factored into what you're paying for.
Right.
I guess it is weird when you have to start paying it for yourself because like when I turned 26, I came off of my dad's policy and he's like, okay, you have to go get yourself insurance now and I'm not paying for it. And I was like, wait, $700 a month I have to pay? I never even get sick. But as a doctor, I know that you never know when you're going to get sick. You never know what accident can happen.
I know.
And because America's healthcare system, unfortunately, is one of the most expensive in the world, if something happens, the bill is just absurd.
It's crazy.
Yeah, for sure. A lot of medical conditions have a huge anchor inside how we're feeling mentally. So how much that bump means to you is also tied into how you're feeling mentally. So when a patient comes in with low back pain, or a patient comes in with their shoulders not moving the way that they want to move, a lot of times
I have that too.
I'll chat with them about their mental health, and they'll get really confused as to why I'm talking about mental health when they're talking about their elbow or their shoulder. But in reality, they're so connected.
Yeah.
A lot of people say mind and body. It's mind-body. It's one thing. It's so connected, not only through nerves, like how everything's connected with the brain, but also through chemicals. Like our brain releases neurotransmitters that go all across the body and have actions all across the body. So if you have pain, but you're in a really good mood, you're going to perceive that pain a lot less than if you're in a really bad mood. My job is not only to diagnose, treat, give options and all that, but also to figure out why the patient's actually there. Not because they have a cough, but what's their question about the cough? What are they concerned about?
Right.
Do they want the cough to go away tomorrow because they have a speech? Do they want to make sure that they don't have a cancer? Do they want to make sure that they don't need antibiotics? Are they just trying to get antibiotics? So there's a lot of questions that need to be placed that I don't think doctors do well, and that's what I'm trying to get the message out there. That, Look, you're the prime example. You were coming in with physical symptoms. But as you realized later on, you got a diagnosis that wasn't a physical diagnosis.
And once I was diagnosed with PTSD and treated for it, all my
All the
symptoms
symptoms
went away.
Right?
Well, now let's talk about all the ways in which I'm broken.
Aren't we all though?
And I need to be fixed. Yeah, this could go deeper. Okay, 2 years ago, I want to say I did this video where I tried to do a manicure without sight. Because I get my nails professionally done. So I was like, I wonder if I could do this myself.
Okay.
So I did it myself. Videos online, link below. Self-promo. And I got an infection. And it like swelled up really bad, la la la. And ever since then, it's been like 2 years, and I just have this like hard bump.
It looks like did you pick at it when you had the infection, or
I don't think so.
scratch it or anything like that? It's like you didn't manipulate it.
No.
So what happens sometimes when you get an infection, your body creates scar tissue. And scar tissue isn't as soft as your regular skin. And that scar tissue creates this bump. Actually, you can have that even removed, and it'll create a better like scar layer where it will looks like you won't even have anything. But that's just a scar.
Okay, that's what
so it's not that
I thought it was probably scar tissue.
Yeah. But again, not an official diagnosis. Seeing a plastic surgeon, figuring out how they do it, and asking him those questions, that's how you know who's a good doctor.
10 years ago, yeah, when I was 15, I'm 25 now. When I was 15, yes, I still look 15, but I am 25. I got okay.
But her voice is 95 today.
When I was 15, I got vocal nodules.
Okay.
It's basically like calluses on your vocal cords. So they don't, when you're speaking, they don't like touch the way they're supposed to. Too much air gets through and you have a very hoarse voice and it's very uncomfortable. Some people have to get them surgically removed. In Canada, at least the way they do it is you have to go through 10 weeks of speech therapy to retrain yourself on how to speak.
Okay.
And
before or after the procedure?
Before.
Okay.
If they go away, then you don't have to get surgery, but after 10 weeks they re-scope you, which is the most painful, uncomfortable procedure I've ever had. And
I had it done too.
it's horrid. It is horrid.
It's not fun.
It's so bad. Mine were gone after 10 weeks. My voice completely changed.
In a good way?
I mean, depends what you think.
You, from your perception.
I got rid of like a weird speech impediment, so that was good.
Okay.
But I went from having a naturally raspy voice to having like a more, I guess, high-pitched voice.
Okay.
So I did a whole video titled Why My Voice Changed.
Okay.
So I'll link that below as well. Ever since then, and I never had the issue before, ever since then, so for the past 10 years, which sucks because I'm a professional speaker, I'm so prone to getting laryngitis and losing my voice like really easily.
Okay.
And it's just so annoying. Does that make sense to you? Is that like normal? Is it because like my vocal cords were like...
So sometimes folks are genetically predispositioned, whether that means anatomically or within their blood, there's a lot of inflammatory cells, that if they overuse their vocal cords, they'll go out quicker than others. They'll develop nodules easier than others. And we don't even really have the genetic understanding of why that happens. I wouldn't say that you would get like an official diagnosis of laryngitis, because my diagnosis of laryngitis is more of an infectious process, where like you have a virus that causes your laryngitis. Because 80 or 90% of laryngitis caused by virus, not bacteria, because bacteria doesn't really get in there much. But you could have laryngitis in terms of an inflammatory laryngitis, which means from overuse. And actually a less common thing, well, less known, but very common thing, is called laryngopharyngeal reflux. Big word. But really it's acid reflux, like when acid crawls up out of your stomach and causes heartburn, but it crawls up so high that it actually touches your vocal cords. And if even a small drop of that acid touches your vocal cords, you're going to be hoarse for weeks. So is it possible that you have a component of the inflammatory kind, combined with maybe some acid reflux, combined with getting a viral infection every now and then, especially in the wintertime, that you're getting all of this? It's possible. In terms of fixing it, the simple lifestyle things that I recommend to people is eliminating or lowering the amount of spicy foods that they're eating, because that bothers the vocal cords. Citrusy foods, like very citrus, like lemon juice.
I love lemon juice.
See, that can bother the vocal cords. Also, the amount of coffee we drink, because coffee stimulates acid secretion, unfortunately. Caffeine does. And then also not eating too close to bedtime. Do you do that?
No, I don't usually eat close to bedtime.
Or like snack in the middle of the day?
No, I don't.
Okay, well good. So you got some of the lifestyle things right there.
Oh my god, it is sweltering in here.
I'm sorry, these lights are really
I'm always cold, and oh my god, I just had this moment where I was like, I'm in menopause. I'm in menopause. I don't know if I'm double jointed or not, or what it's considered, but I like it.
Ooh, okay.
Like, sorry. I love your reaction. Ooh, okay. It used to really freak people out. They thought I lived, like, I'd be like, ow! And, like, they thought I, like, broke my face.
Does that hurt
No.
when you do that?
No.
And how did you figure out that you can do that?
When I, like, when you, like, go to grab something and you, like, you just spread your hand.
Yeah.
When I spread my hand,
Oh my god.
it just, like, pops out.
Okay.
So it's just always, I didn't know it wasn't normal.
Okay, yeah.
Until I, like, did that, and somebody was like, oh my god! And I was,
Did you
like,
dislocate yourself?
freaked out, and I was like,
Okay.
like, it's hard for me to, like, open my hand. Like, I can, but it's, like,
Difficult.
for me to fully extend as far as I can, it pops out.
Okay, interesting.
This one I can, like, go in and out really quick. Ooh.
Wow, look at that. There's something that exists called, like, hypermobility, right? So people are hypermobile in their joints, like what you would call double jointed. They're able to make their thumb touch their forearm. They're able to push their elbows way more extended they can, and it looks like their elbow's broken.
Yeah, it's
so
crazy.
They can do a lot of these contortions.
People who can, like, go, like, all the way around.
Yes, there's a lot of things that people can do which freak me out.
Mm-hmm.
But the important thing to note is that's actually a risk factor for developing injuries. Why? Because if you are hypermobile, it means that your body is not good at defending against an injury. So for example, like my joint is only supposed to go to this area. If I'm hypermobile, I'm already putting way more stress on that joint than it's naturally designed to experience. And because of that, it's more likely to develop arthritis, it's more likely to develop a tear, inflammation, all that stuff. So hypermobile people do suffer with that sort of thing, like increased rates of arthritis. There's also conditions out there that where people are hypermobile, they also have heart conditions as a result. Like the ones that come to mind, Marfan syndrome, Ehlers-Danlos syndrome.
I was gonna say EDS.
So there's times where patients come in and I see they're hypermobile, I'll start asking about their family history, see if there's any genetic things going on. To me, that looks like you may just have an anatomical anomaly where
That sounds so normal for me because I have like a lot of super rare diseases.
Yeah.
So it's just like, sounds about right.
It's just in one area and it looks like maybe your joint is shaped a little bit differently, or maybe that one of your ligaments is attached a little bit differently. As long as it's not causing you symptoms and it's isolated to that area,
yeah.
I always say be alert, not anxious.
I was just like curious. I was like, what do you think of this?
You know what's funny? I wish we had like a hand surgeon on that could be like, oh, well, that's the diagnosis for that.
Right.
Because in medicine,
there probably is a word.
Yeah, there's so many medical conditions out there that I don't know the titles of. I mean, it happens all the time, especially as a family medicine doctor. Anyone can come into my office with any complaint anytime, and I have to know it. So a lot of times, I'll talk to the patient, I'll pull up our sources, like what we use to look up conditions, and I'll do it with the patient. I'll say, well, let's look this up together. Let's see what this is called, or let's see like what the optimal plan should be.
Hey, guess what? One of my diseases is 1 in a million.
But tell me about
Aren't I special?
I like it. Okay, that's a positive way to look at it.
I love it.
You're
I'm
doing
literally
PTG.
1 in a million.
Are you comfortable saying it?
Oh yeah, it's spasmic neutons
Okay.
in my brain.
See, medical doctor don't know what that is.
It's a brain condition.
You should title this video "Molly teaching Dr. Mike about medicine" because I feel like that's what you're doing right now.
Well, this could be the video on your channel.
Yeah.
I could tell you all about my diseases.
Tell me.
I have so many. Basically, my entire head would shake constantly. So I'd just be like,
Okay. Wow. But now, like in a seizure way, like where
it looked like I was having a seizure just in my head.
Wow. Okay.
So it's like my eyes are shaking, but my entire head would do that.
Okay.
And it would never stop.
Okay.
Just
And
24/7.
then how did it end up stopping?
So with spasmic neutons, you like grow out of it. So
Okay.
you're supposed to just grow out of it by like 2 or 3 years old.
Okay. I thought that was a really exciting one. I guess it's not that.
No, trust me. Mesa, both Mesa's parents are doctors. Is my last one exciting?
It's a lot.
I'm excited.
Yeah.
Is it something you think I've seen?
No.
Okay. Cool.
And it's disgusting, and I can't believe I'm revealing it to the internet because it's like it's the thing that embarrasses me the most in the world.
So we're gonna have a revelation no one knows about.
No physician I've seen takes it seriously. They're like, oh, put some cream on it. I'm like, it's bleeding!
Okay.
My toe hurts when I walk.
haven't seen the picture. I'm gonna look at it right now. God, it looks so little. You made it seem like it's like the most evil looking toe ever.
Well, that's why people look at my feet and don't realize how gross they
Well,
are.
it's because the toe has like swallowed the nail.
Yeah, that's what it looks like. Well, it looks angry.
It feels angry, frankly.
It's like an angry little toe that looks like the nail is gone.
No,
Like,
it's
is there
really
nail?
hard. Yeah, it's really, really hard.
But I don't know if it's hard because that's scar tissue over the skin, or is that an actual nail? Like to me, I don't even see.
Do you want to
nail.
see it live in person?
This part is the skin.
So there's a nail.
Oh yeah.
But then-
it looks so different than in the picture.
Well, it's because it's not
There's
bleeding right now.
polish on it.
No. So if you were to shave or file the top of it, it would bleed.
It'll bleed.
It warrants further investigation. I give you a referral. Will it work in Canada?
Oh, maybe.
They're going to give you a referral and be like, must see dermatologist.
My feet smell. Sorry.
No, I always say to people, they're like, oh, medicine has advanced so much, over these last years. Like, no, it hasn't. We suffer with toenail fungus. Like, it's crazy because when my patients come in with toenail fungus, I really have two options for them. I can give them a cream, which work like 20% of the time, which means that they don't work.
Yeah.
And then there's pills that you have to take for months that could hurt your liver and have all these side effects and all that. You have two options and both aren't great. And then you have the really expensive option of doing laser, which not a lot of people can afford. So toenail fungus is a real problem.
But what is this?
I feel like you have a very advanced toenail fungus. That's what I would call it. I would call it advanced toenail fungus.
I'm advanced. Now that I've exposed my most embarrassing aspect, I don't get embarrassed easily. My feet are the most embarrassing thing about me because they're just so filled with any bad fungus you can get. Like, I can't date a guy with a foot fetish. Like, if he's like, I want to kiss your feet, like, I'm like, I will not let you put, like, this fungus in your mouth.
I have literally, I feel like this has been, I've given the least entertaining or informational advice here because all your complaints are so unique, and I don't even have great answers.
Maybe
Like
it's
I don't
they're
know
all
anything.
related to the Molly Burke disease.
Yeah, I don't know. I know nothing about your eye condition. I know nothing about your foot condition. I don't know how to fix it. Your shoulder, I can't really diagnose on camera. But I did get your finger. I at least diagnosed the scar tissue on the finger, which is the least exciting condition.
Her mom suggested maybe it was a corn.
I mean, that's basically scar tissue. So we learned a lot today. I learned that I need to go and read more in my medical textbooks.
About
that
toenails that
I'm a
bleed.
failure in not knowing medical conditions. Like ushers, I need to learn what ushers
Yeah,
is.
Usher syndrome.
I need to look it up.
It's like 1 or 2.
And I need to reach out to my medical folks to see if they want to do a case study on Molly Burke syndrome. Which of your conditions or diseases would you put in Molly Burke disease? Which do you want to represent you? Would you do like thumb, toenail, vision?
I would do like definitely vision has to be in it.
Okay.
Probably the shaky head thing. That's pretty unique.
Okay, yeah.
The finger thing. That's
Okay,
good.
that's good, yeah.
Yeah, the bleeding toenails because that's a weird one.
Yeah.
And the low protein S in my liver.
Okay.
That'd probably be
Maybe that's why you're bleeding too. So look at that. Like we're connecting stuff to Molly
So,
Burke disease.
Now you guys know my embarrassing toe situation.
And her horrible medical situation. You need to get doctors here in the States because you're going to be living here and your old hip is about to run
I
out.
know. Okay,
What happens when it runs out? Are you like...
It'll run out in January and then I'll start paying for insurance.
Here.
Yeah.
Okay, cool. That's when the enrollment period is for insurance.
And now that you guys know about this situation, I'm gonna go to a dermatologist and I'll bring you guys with me.
Yay!
So we can all find out together why my toenail
And so I
bleeds.
can find out. Yes.
Bleeds! Gushes from the center. Now you know everything about me that's awful and I'm over it. So,
I think this video is like us exposed. Like your medical conditions exposed, my lack of medical information exposed. It's perfect. And I think the audience has a really good concept of who we are.
Molly Burke and Dr. Mike exposed. I'll link the video below that we're going to do on his channel. Go follow him and subscribe if you haven't already. And if you're over here from his channel, come join the Killer Bee family and subscribe. Okay, bye!